If, on the other hand, the patient complains of pain more in the afternoon, they say, around 2 or 3, I start to have my symptoms. Symptoms in the back or symptoms in the legs. Sometimes going to the ankle, going to the toes. And I say, before the symptoms start, when you take your lunch, you need to take a break. So how do you take the break? Well, you can lay down. And so I show you on the picture on the top. If patients say, from your history, do you sleep, or do you like to sleep on your back, on your side, on your stomach? So I like to sleep on my side, or I can only tolerate the side-lying position. Well, here's a position that you can use to read your book that you see here on the top on the left side. If they say, no, I prefer to be laying down on my back. So I can put a little stool underneath the feet if they like the flex position. Or they can do it in the prone position if they prefer the prone position, or the seated position. If they say, I cannot lay down at work, you can do it in the seated position. And I'll share with you the research that has been done. But it shows that if patients are seated with a backrest in a slouch position, that position will tend to rehydrate the disc. And I'll share a little bit later what research has been shown if you like the lordosis in the slouch position, if you like more the kyphosis, what it can do to rehydrate the disc. The 3D position. You saw it before from Dr. Phelps. He talked about the 3D position to help to centralize the symptoms, decrease the pain. It can be used to rehydrate the disc. And so the studies have shown that how much do you rehydrate the disc? How much can you rehydrate the disc? We do it in the clinic, and we can do it as a mobilization or as a manipulation. But the whole technique, when we hold for about a series of 40 seconds, when we repeat this technique, and before using the technique, the patient comes if the afternoon is dehydrated, it's a little bit shorter. Well, the technique shows that in 10 minutes, you're going to gain about 6 millimeters of height. Of these 6 millimeters, about 60% are coming from the lumbar spine. So you look at the symptoms. Can the patient do it at night? The study from Sohal Halir in 2019 shows that without the hand position, if the therapist is not there, if this position, this 3D position, help to centralize the symptoms, decrease the symptoms, patient can adopt this posture at home.